So this session is now being recorded, and thank you everybody for attending today's ACA webinar put on by Plumline Consulting and Integrity Data.
Great. Well, thanks, Valerie. I appreciate the opportunity to present. My name's Tom Franz. I'm Client Engagement Manager at Integrity Data. Valerie and I work very closely together to service the ACA solution for Dynamics SL clients, and we just really appreciate everybody participating today. I'm a certified payroll professional with the American Payroll Association and a certified healthcare reform specialist. So I can speak with some authority in the payroll and human resources world, and like to think I know about as much as anybody when it comes to the Affordable Care Act and how it affects employers. So with that, we'll move into the agenda. Do a quick introduction of Integrity Data, tell you a little bit about us and our relationship with Plumline, and then we'll talk really about the meat of why everybody is participating today and find out what's going on with the Affordable Care Act, especially right now in the Senate. That's where the big activity is going on currently. We'll recap the employer mandate. We'll talk about what needs to be done in 2017 from an ACA compliance perspective. I've got a few resources to share with you. And then we will have time for Q&A at the end. So feel free, if you have questions, to put those into the question section of the GoToWebinar control panel on the right side of your screen. Just enter those questions. If it makes sense as we go through those to try to answer those, I will. Otherwise, we'll save those for the end. So thanks again. And for a quick introduction, Integrity Data, well, I'll let Valerie talk about Plumline and the relationship first. Sorry, Valerie, go ahead.
Sorry about that. So Integrity Data and Plumline Consulting have partnered together to provide the ACA solution for our SL customers. So Plumline Consulting, we have over 100 add-on solutions for Dynamics SL. We also do SL implementations, and we work with the actual Microsoft team for development, support, and marketing. So as you all know, we've been around for over 25 years, and I think that's all I have to say about us for now.
And one of the great things about the relationship between Plumline and Integrity Data is the fact that Plumline Consulting has invested in the integration components that connect Dynamics SL directly into the Integrity ACA solution. We're not going to really get into talking about that solution today for sake of this webinar, but just know there is a tight integration available through Plumline Consulting. So Integrity Data, we've been around for over 20 years ourselves, mainly on the Microsoft Dynamics GP side of things. We have several embedded solutions, and like Plumline Consulting, we authored some solutions that are currently sold and supported through Microsoft directly. So we've been immersed in ACA compliance since 2012, when the first regulations really started coming out after the law was passed. So, and we've helped over 1,250 unique EINs last year complete their 2016 ACA filings. So we're going to go ahead and do our first poll question of the day, just to kind of get a feel for where everybody's at. We just want to know, do you have a good understanding of the history of the Affordable Care Act? And maybe you kind of know what it stands for, or you can talk the talk. Maybe you even know the date it was filed. So if we could get everybody to participate in that poll, just feel free to vote. And when we're done, I'll share those results with everybody. It looks like a majority of people are voting are coming in that they know what it stands for, and that's about all. Some can talk the talk, but doesn't look like we have anybody so far that can tell us what the actual date the law was passed. We'll leave that open for another couple seconds here and give everybody a chance to participate. And I'll go ahead and close that poll, and we'll share the results here. So as you can see, 80% of our participants just have a very basic understanding of the Affordable Care Act, which really helps us guide the conversation for today, and we'll try to speak accordingly. So thanks for everybody for participating in that. I'm going to go ahead and hide those results, and we'll move on with how did we get here and what's going on with the Affordable Care Act. Well, how we got here, so the Patient Protection and Affordable Care Act was originally passed in March of 2010. And I don't know if everybody remembers, but last March, the House of Representatives was pushing very, very hard to get a vote on March 23rd of 2017, which would have been 10 years to the day that the original act was signed into law. That didn't happen, and as a result, things got pushed out. We'll talk more about that here in a moment. Since the implementation of the law, there have been over 70 different changes and delays, several administratively, some that were as a result of legislative action by Congress, and then we had some Supreme Court cases that actually impacted the implementation of the Affordable Care Act. And many people look at it and think, it's been sliced up and holes shot through it, and it does somewhat resemble Swiss cheese today, and does make compliance a little more tricky. Under the Obama administration, there were several efforts to repeal the Affordable Care Act, all of which were mostly symbolic, because obviously then President Obama would not have signed any type of repeal of the Affordable Care Act. So while the House of Representatives was actively putting through legislation to repeal it, and the Senate on a more limited scale was doing the same, they knew that they were never going to get anywhere with that legislation at the time. In addition, there have been several proposals to replace the Affordable Care Act. The most notable one there at the end was the American Health Care Act, which was put through the House of Representatives. And we'll talk a little bit more here in just a moment. In January, just after the President Trump's inauguration, he signed an executive order. Then the wording in that was to minimize the burden of the Affordable Care Act on various individuals, families, healthcare providers, and so on. Notably omitted was any reference to employers, and also, as with most standard verbiage in those executive orders, it says to the maximum extent permitted by law. Well, law dictates that penalties apply if employers don't provide affordable coverage on a timely basis to their full-time equivalent employees, and the executive order could do nothing to remove that requirement on employers. So fundamentally, that executive order had no impact to employers at the time. So more recently, the House did pass the American Health Care Act. That was, like I said, put out first in March, and then a reworked version did pass the House in early May. And then the Senate has put two bills forward, two draft versions of the bills forward, the Better Care Reconciliation Act and the Obamacare Repeal Reconciliation Act. Fundamentally, the biggest difference between the two, the Better Care Reconciliation Act was similar in many ways to the American Health Care Act, in that it tried to replace, it was a repeal and replace type of action, whereas the Obamacare Repeal Reconciliation Act is purely a repeal that would repeal the penalties associated with not offering coverage, or as an individual for not having coverage, but it was a 2-year delay, or is a 2-year delay. So nothing would change for 2 years, even if it were signed in as is. So both of these bills have been thought to be dead on multiple occasions. They're both semi-alive right now in the Senate, notwithstanding yesterday there was a procedural vote in the Senate as to whether to move to the full floor of the Senate for debate on healthcare reform. And that passed just barely with a little bit of flurry around the fact that Senator McCain, who was recently diagnosed with brain cancer, made the special trip into the Senate to make sure to get his chance to vote so that it would be a 50-50 tie. And then Vice President Pence cast the deciding vote and passed the motion 51-50 to proceed to full debate on the Senate floor. Late last night, that kind of exuberance for getting that procedural vote passed, they had 7 Republican senators defect, if you will, when they voted on an amendment on the Obamacare repeal and the Obama Repeal Reconciliation Act. So that one is not looking good. They're supposed to go to a full vote this afternoon on it. There's some confusion. The Senate parliamentarian says that some of the amendments on the bill are not allowed according to the Byrd rule. So it gets semi-complex, but fundamentally, when you talk about reconciliation acts as opposed to a regular bill through Congress, the fundamental difference is a reconciliation act only requires a narrow majority to pass. So they only need, 50 votes, or 51, if you will, votes to pass in the Senate, as opposed to a non-reconciliation bill, which would require the traditional 60 votes to pass. Republicans only have a 52-48 majority right now in the Senate, so that doesn't allow for them to kind of do whatever they want, if you will, in terms of repeal and replace of Obamacare. And that's really important to consider, because even though it says it's a repeal, technically they're not repealing the original law. They're changing some of the aspects of Obamacare, but the Patient Protection and Affordable Care Act would still stay in place, along with many of its provisions, including the reporting requirements. So, and that's important from an employer's perspective. There's still a very rough road ahead. There's a very slim path to any type of repeal of the Affordable Care Act. And then, like I said, that repeal is really a repeal of the penalties associated with not offering coverage, but not the penalties associated with not reporting. So even if they do repeal the bill outright, per se, employers would still be required to do the annual reporting. They may not have to offer coverage to those part-time employees, but they are going to have to report to the IRS at minimum all of those employees that were offered coverage. And the main reason for that is all of these bills in some fashion or form continue to provide a tax incentive to individuals who were not offered coverage by their employer. So if I, as an individual taxpayer, was not eligible for an employer-sponsored plan, I can get some type of tax subsidy or tax credit back from the government to help offset my cost of health insurance. That's great, but the IRS then says employers must tell us who they offered coverage to, so that we can reconcile that with the employees that are the individual taxpayers who said they weren't eligible. All of that to say, reporting is going to likely stay in place. There have been conversations about simplifying the reporting, moving the reporting over to W-2s, all of which is still conjecture and several years out. So one of the more recent things that the Senate is looking at is what they call a skinny bill, and all that bill would do is change the penalty amounts to zero for not offering coverage or not having coverage as an individual, with a 2-year delay, and with the plan that they would build a replacement plan later. So That in and of itself probably has the most likelihood of getting through the Senate at this point. The challenge, once it does get through the Senate, is it will have to go back to the House and go through that reconciliation process. And there are strict rules on that, and they may lose some Republican House support if they don't have some of those provisions that were in the original House bill. Gets convoluted really quick, but ultimately, you know, the guidance is, you know, ACA is still the law of the land. You know, the IRS is actively enforcing the requirements of the Affordable Care Act. There was no action taken by the IRS on the executive order as it pertains to the employer mandate. They did make a slight change for individual taxpayers in that the Form 1040 that taxpayers complete at the end of the year, they did not necessarily have to complete the section indicating whether or not they had coverage all 12 months. The ACA compliance validation system went live in May, and that's kind of the clearinghouse of information necessary to determine which employers are potentially subject to a shared responsibility payment, also known by employers as a penalty. So those penalties kick in when coverage isn't offered, or the coverage offered wasn't of ACA standards, and the employee went to the exchange and obtained a subsidy. In addition, there's penalties for when 1095-Cs are not provided on a timely basis to the employee and the IRS. So our best advice, employers need to stay the course and comply. 2017 reporting is highly expected. Like I said, all of these bills would likely include reporting at minimum through calendar year 2019. So even into January of 2020, employers are going to be filing the 1095-Cs at minimum. And willful non-compliance. So if an employer has not done anything, they are putting their organization at substantial risk for penalty. So let's go ahead and open up the next poll question here. Do you have a good understanding of what ACA compliance means from an employer perspective? Maybe you don't even know you need to do anything. Maybe you need to know you need to offer insurance, but not sure what else. Maybe you have a pretty good handle. You've got a pretty good handle of the requirements of compliance as it pertains to the ACA. We're getting some votes in here, so we'll give that a few more minutes, a few more seconds here to give everybody an opportunity to participate. And it looks like almost evenly split here on the last two options. Most everybody seems to know that they need to be doing something. So I'll leave that open here for just another moment. And I'll go ahead and close that poll. And we'll share the results. So as you can see, 9%, you may not have to do something. The other 36 knows that we need to offer coverage, but not quite sure what else. And then over half think they have a pretty good handle on ACA compliance. So I'll go ahead and hide those results. I appreciate everybody participating. And we'll move on to kind of recapping the ACA employer mandate. So what does compliance with the Affordable Care Act mean from an employer perspective? Well, one of the first concepts we kind of need to wrap our head around is the concept of shared responsibility. So back when the Affordable Care Act was passed, there was this idea that we're all in it together, meaning individuals need to obtain health insurance, and employers need to offer it. And that health insurance that people have and that employers offer needs to meet certain standards, needs to provide what is called minimal essential coverage and minimum value in order to ensure that it's adequate in the marketplace. So from an employer perspective, who needs to be ACA compliant? And that's every U.S. employer with at least 50 or more full-time employees. And you'll notice in parentheses it says including equivalents. So there's a not too complex, but a semi-complex calculation where you sum up the hours from all of your employees that you don't reasonably expect to work at least 30 hours per week and get a equivalent full-time employee count. And then you add that to your actual full-time employees. And from an ACA perspective, that's anybody that works at least 30 hours per week. Sum that up, and if it's at least 50, you're an applicable large employer and you must comply with the Affordable Care Act. In addition, you have to consider employees in affiliated companies. Good examples are the restaurant group industry, where you might have a father that owns multiple restaurants and maybe has shared ownership with his children in 3 or 4 different restaurants. They all have shared ownership. Each individual restaurant may only have 20 employees, but by the time you get 4 of them, you've got 80 in aggregate. Now that whole group is an applicable large employer and must comply with the Affordable Care Act. So we talked a little bit about large employer, but it's anybody with at least 50 or more employees, including equivalents from the previous tax year. So generally speaking, in December of 2016, employers made an ALE determination to see if they are subject to the Affordable Care Act for calendar year 2017. In December of 2017, they'll do the same thing for 2018. Typically, it's pretty clear you either are or are not an applicable large employer, but there are those employers that are right on the cusp. Right? Maybe they're 48 to 52 employees per year. They may fall in and out of subjectivity to the Affordable Care Act year over year as a result. So one of the things I've been talking to is average hours per week. And those hours per week are not just clock hours, but also include situations where the employee is paid but not actively working. Can also include some other items. We'll get to that in just a minute. And full-time, like I said before, is that 30 hours per week, which equivalates to 130 hours per month. So if you take that 30 per week times 52 weeks divided by 12 months, you'll get the 130. So a couple different ways to look at it, but full-time, if they're averaging 30 per week or 130 per month, they are considered full-time and need to be treated as such. Hours of service, like I said, are not just paid hours, but also include unpaid leave for family medical leave, jury duty, military deployment. There's some other items there as well. And you need to consider those hours of service when making your eligibility determinations. It's something that everybody considers. We talked already about commonly controlled or affiliated groups, but if you have common ownership, if you provide services back and forth to one another, or jointly you provide services to others, if any of those are yes, you're most likely a control group and subject to those requirements. Many employers aren't quite sure if they are or are not. Our best advice is to check with your CFO or legal counsel. And generally speaking, somebody at that level will know whether your organization is or is not a control group, because this is not a new concept to Affordable Care Act. It was one that was adopted and set to apply to Affordable Care Act compliance. Measuring hours of service for those variable hour employees is sometimes a little more challenging. And the concepts that the Affordable Care Act put in place for doing that are sometimes hard for employers and consultants to get their heads wrapped around. So I thought it makes sense to kind of talk about how the Affordable Care Act measures hours of service. And there's 2 primary ways. One is called the monthly measurement method, and that's very, very easy. although it's retrospective. And in that, what I mean is an employer looks at how many hours an employee worked in that month, and if it was at least 130, they're eligible for coverage that month. The challenge is you don't know that prior to the start of the month when you need to be offering that coverage, that insurance to the employee. So generally speaking, most employers don't use the monthly measurement method. They use the look back measurement method. And that's what I'm going to kind of focus on right now, because that's the most common form of measuring hours of service for an employee. And what we have a what they call a stability period, an administrative period, and a measurement period. So in the administrative period is kind of the easiest one for us to wrap our heads around, because that most commonly correlates to some kind of open enrollment period with our health insurance plan. So if we had a calendar year health insurance plan that ran January 1st or January through December 31st of 2016, and our administrative period was right at the end of 2015, maybe it's a 90-day administrative period. Maybe sometimes it's less than that, 30 to 60 days. But during that time frame is when we extend offers of coverage to eligible employees. Well, for full-time employees, that's usually pretty easy, right? But for those part-time employees that have hours that fluctuate week over week, we have to sum up their hours for a period of time, most commonly 12 months, divide that by 12 and see if we get at least 130 hour per month average. And if we do, that employee is eligible for insurance. We have to extend them an offer of coverage in the administrative period. That offer of coverage then stays into effect during the life of the stability period. So in this case, for calendar year 2016, if that employee tested as eligible during the administrative period, they would retain that insurance throughout calendar year 2016. Next year, at the end of 2016, we're going to do it all again, and we're going to add up that employee's hours again and divide by 130 and make a new determination. So it's very possible that these variable hour employees, one year could be eligible, the next year not eligible, and then eligible again. It's up to the employer as to whether or not they want to go ahead and continue that coverage, even when they're not required to according to the law, or retract that offer of coverage in subsequent years. In addition to the periods of time that we are measuring employees on an ongoing basis, anytime we hire in a new employee, we have to begin what we call an initial measurement period. And those usually begin on the date of hire or the first of the month following the date of hire. And we'll measure them again, typically, most commonly for 12 months. We'll have some type of administrative period, might be what we typically can consider a qualifying event type of period where we can offer coverage to an employee if they get married or have a child or something like that. We'll oftentimes give them an opportunity to make changes to their health benefits. This is a kind of a similar qualifying event in that they completed their initial measurement period. Again, so in an employee that was hired in 2015, sometime in 2016, we're going to do that. We're going to sum up their hours for their first 12 months. We're going to divide by 12. We're going to see if they averaged 130. If they did, we're going to extend that offer of coverage, and it will stay into effect for most commonly 12 months. There's some flexibility on how the time periods that you can set these up, but generally speaking, most employers use 12-month measurement and stability periods with anywhere from a 1 to 3 month administrative period. But that insurance offer then stays in place. So you'll notice that new hire that was hired in 2015 has stability that runs into 2017. And then we would then, that bottom measurement period would then kick in, and we would measure them again at the end of 2016. So even if that new hire tested as not eligible in our ongoing measurement period that completed at the end of 2016, I wouldn't be able to retract that offer of coverage until the end of the stability period that's associated with their initial measurement period. So they would continue that coverage well into 2017, even though they tested as part-time in the ongoing measurement period. All of that gets a little complex, and you got to understand, as we hire in employees month by month, theoretically month by month we could have employees becoming eligible for insurance, thus the need to maintain a process, or have a process in place for extending those offers of coverage on a regular basis. So which employers are most vulnerable? Well, if you have a large variable hour workforce, and the hospitality industry, restaurants, and so on are good examples. Temporary employment agencies, temp hire agencies are highly subject to, or have special challenges in this area, as well as some others, and you'll see that by state as well. So what do employers need to do to comply? Well, they have to comply with the coverage mandate by offering coverage that meets the standards of the Affordable Care Act on a timely basis and comply with the reporting requirements. The best way to avoid any potential penalties with the Affordable Care Act is to offer what's called a qualified plan to employees. A qualified plan is one that offers minimal essential coverage, minimum value, and that can be thought of as that 60-40 plan. It needs to at least have that bronze level of coverage. So after deductibles, the copay amount is typically less than 40%, and that's an actuarial value, so it gets a little more complex than just the copay percentage, but fundamentally that's what it is, and it must be affordable according to the specific federal poverty line safe harbor. And we'll talk about those a little bit more in detail here coming up. Affordability, it's one where the self-only coverage does not exceed a fixed percentage of taxpayer household income for the tax year. Challenge from an employer perspective is, I don't know how much household income there is. I don't know if they have another job. I don't know if they have other types of income, maybe investment income. I don't know if maybe the spouse works or not and brings income into the home. So for that reason, employers can't be sure that they're providing affordable coverage according to the letter of the statute. So the IRS provided certain safe harbors that allow an employer to warrant that their offer of coverage is affordable in a few different ways. The W-2 wages safe harbor says that it's, we use box 1 wages of the W-2 to determine affordability. Rate of pay, you take your lowest paid employee, and if their rate of pay is at a certain level, you can use rate of pay. And the one for a fully qualified offer that's required in order to mitigate any potential risk of penalty is the federal poverty line safe harbor. And that's there's a great blog post that goes into these in more detail. I'm sure that Valerie will be providing the deck along with the recording, and that link is in the deck. A couple different types of penalties here. The sledgehammer penalty, and if an employer just says, I know the ACA says I have to provide insurance, but I'm not going to. They're really putting their company at risk. We call that the sledgehammer penalty. The smaller penalty for non-compliant coverage, and non-compliant could be maybe it doesn't provide minimum value or minimum essential coverage, or maybe it's not affordable to the employee, only applies when an employee goes to the exchange and obtains a subsidy for that month. So it's very common to see employers' ACA strategy to be one to offer a non-compliant or non-affordable plan in order to comply with the Affordable Care Act, knowing that many of those employees are likely not going to go out to the exchange and obtain health insurance. In addition, if you don't file, there's a per form non-filing penalty as well. And that's where we talk a little bit about the play or pay rules. Probably heard this at one time or another. Employers can either play along with the ACA and offer health insurance, or they can just opt not to offer coverage and pay the higher penalty. So let's go ahead and we'll do our third poll question here. Are you actively engaged in a compliance strategy for 2017? And this may not apply to everybody, especially if you're a consultant, but go ahead and answer those if you would. Maybe that's why you're attending the webinar. Maybe you're just getting started. It's moving along well, or you got it in the bag. You're set and ready to go. We'll leave that poll question open here for a moment. Let everybody participate. Give it just another moment or two here. And I'll go ahead and close that poll and share the results. So it looks like a little over a third. That's why you're here today attending the webinar, and that's great to know. And Valerie can use that to make sure you have the necessary information to make a good decision on a solution moving forward. And we do notice that a good portion are moving along nicely, or they're ready to go. We're going to assume that those are Integrity ACA Dynamics SL customers already, and they're using a great solution and for their compliance strategy, and they were here to just get caught up on what's going on legislatively, as well as kind of refresh your memory on what's required from an employer strategy perspective and ACA compliance. I'll go ahead and hide those results, and we'll move on and talk about what employers need to be doing this year. Well, they need to be completing their Form 1095-Cs. And the biggest difference between a 1095-C and a traditional W-2 that we're all familiar with, because we've been getting them for years as employees, is that a W-2 is an annual summary of data for the year, whereas a 1095-C is a month-by-month report of what transpired throughout the year. So that monthly reporting is what becomes problematic and challenging for many employers. So what they need to be doing is continuously tracking hours of service for the employee on a month-by-month basis, determining which employees are eligible for that offer of coverage and extending those offers. And then on an annual basis, doing that ALE status determination that we talked about earlier, providing a 1095-C to the employees, and then a copy of that along with the cover form 1094 to the IRS. We've talked about this a little bit already, but that hours of service, you need to be keeping track of that unpaid time is in addition to hours on the time clock, or paid leave, PTO time and vacation pay and that sort of thing. So monthly, need to be identifying those employees that are full-time, reviewing those that are newly eligible, ensuring that you're continuing to meet the affordability standards, and keeping records of all those calculations and determinations. The IRS and Department of Labor, if they come in to do an audit, saying that you did a thing is not good enough. You have to be able to prove it, and documentation is critical for that. On an annual basis, we've talked about this, but you need to pay special attention to the fact that if you have at least 250 forms, you must file electronically. And that process is very difficult. It's much more challenging than electronic filing of the W-2s to the SSA. It involves generating a fairly complex XML document, getting through a testing process with the IRS, and that's all on the heels of obtaining your TCC ID, which can be a challenge in and of itself. So avoid all of that and make sure you have a solution that'll handle that for you. Filing deadlines that are coming up, the 1095-C has to be out to the employees by the end of January. If you're printing and mailing the 1094s to the IRS, that's the end of February, and electronic filing has to be done by the end of March. And all of these dates coincide now with W-2 filing requirements. So what are the challenges you or your clients could face? We actually still have clients come to us that have not completed their 2016 filing. There is grace that has been provided to employers if they make a good faith effort to comply with the Affordable Care Act, but you have to at least have filed. So we actually still have clients coming to us saying, hey, we didn't do 2016 filing. Can you help us out, get these forms out and so on? Yep, absolutely we can. And it's better to do it late than not at all. Some employers are still having challenges tracking eligibility according to those ACA requirements. Looking back, going back to that slide on the look back measurement method, that can be a challenge. Determining which codes to put on the form, is it a 1A or 1F, 1E, 2C, 2B? I mean, what do I put where? What's the amount that goes on line 15 for the cost of coverage? Because it's not how much the employee paid necessarily, right? It's that cost of coverage for the least cost offering, which might be zero. They may not charge the employee for the coverage. Maybe you have all the codes and you have all the form data, but you have no way to actually integrate that into a solution, print the forms, or electronically file, or keeping up with the changes in the legislation, which is why everybody's here today. I think is probably the primary reason to know what's going on with the Affordable Care Act legislatively and how that's going to affect employers. So let's go ahead and we'll do our last poll question. Do you currently have a solution to support your ACA compliance strategy? And we'll talk next about what's important if you don't have a solution, or maybe what you could look for if you were looking for a better solution. I've heard from a lot of clients that they've been really challenged with their existing process, whether it's a manual process or maybe it's a solution they've had in place and it just doesn't quite meet the need. Had those conversations a lot, and it's always good to hear that the Integrity ACA solution in combination with Plumline and their data connection right into the solution makes that process very, very easy. So we'll leave that poll open here for another moment or two. It looks like several haven't had a need. The rest either have one and it works great, or about half say it's less than ideal. So I'm going to go ahead and close that poll, and we'll share the results and let everybody kind of see where this played out. Looks like about half have one, but it's less than ideal, and 30% have one and it works great. So again, those Integrity ACA customers using the Dynamics SL connection from Plumline Consulting. So great. I appreciate everybody participating in that poll. I'll go ahead and hide those results, and we'll finish up here and talk about what you want to look for. So if you are in the market and looking for a new or better ACA compliance solution than what you've been doing, what's important to look for? Well, it should be easy to use. You want to be able to onboard quickly. And I think one of the most critical things in any solution is it needs to be able to take your raw payroll data, your hours worked, if you will, and then whether or not an employee was covered month by month, and then automatically generate all of those forms for you. If it can't do that and you have a large employee population, you're going to be challenged manually coding those forms at the end of the year, and trying to get all of that done along with everything else payroll professionals have to do in the January timeframe is going to be very, very challenging. So make sure it will automatically code those forms, and that it will handle your electronic filing requirements as well, especially if you're over 250 forms. We all know how painful system upgrades can be. So if you can find a solution that will upgrade automatically, cloud-based solutions are awesome. You don't have to worry about those software updates. That just gets handled automatically in the cloud. Should be comprehensive. It should handle your penalty risk management, your form submissions to the IRS, You want to make sure that you've got good subject matter expertise available as well, so that you can be confident that the strategy you're using, the solution you're using, is the right one. And obviously it should be affordable. Given the fear, uncertainty, and doubt, the FUD in the market related to the Affordable Care Act, if you can avoid a long-term contract, that's good right now too. If the Affordable Care Act was repealed, you don't want to be stuck with a long-term contract of the solution. So I have a few resources for you. We've got an ebook and an ACA checklist on the integritydata.com/ACA page. We have blog, product information, video demos. I know there's some great information on the Plumline site related to the SL edition of our product as well. Always reach out to Valerie if you have questions. Again, these links are available in the slide deck. So your next steps is to get answers to outstanding questions, contact your Microsoft partner or Valerie for a quote, get your order placed, and begin implementation and cruise through your reporting compliance for next year. So if we have any questions, I haven't seen any come in just yet, but if you have any questions, please feel free to put those into the question section of the GoToWebinar in the control panel on the right side of your screen. Valerie, did you have anything you wanted to add at this point?
Only that, the end of the year is not too far away. So if you haven't started planning on how you're going to file for ACA, please reach out and contact your partner or myself so we can help you with our SL edition of Integrity Data's ACA software.
And one other thing I'll share, I'm a member of American Payroll Association IRS Issues Subcommittee, and one of the biggest issues that we hear about are employee personally identifiable information, name, address, social security number, date of birth, that type of information that's in our payroll systems and our human resources systems. It gets exposed in some fashion to nefarious individuals. And there are several phishing schemes out there that try to solicit this information. I can't tell you how many times I've had a client send me an unencrypted email attachment of their employee file that they're having challenges uploading or something along those lines. And that's just a really bad idea. So I just, a courtesy reminder coming from somebody in this industry to be vigilant to protect that information. If you've ever been the victim of identity theft, you'll greatly appreciate the extra effort that people go through to protect your information. And as payroll and human resources professionals, we are tasked with guarding that information on behalf of our employees. One of the things that we've heard about is that an email appearing to come from the CEO or CFO of the company asking the payroll administrator to send them the W-2 file, the electronic data file that typically gets transmitted to the SSA, supposedly didn't happen, and I've got to send it to them right now, email it to me right now. And they'll go so far as to replicate the signature line and everything that might have come from the CEO's email. And when you open up and look at that email, it's by every stretch, it looks and feels and appears like it actually came from the CEO, CFO representative in the organization. So what we always recommend you do at that point as the payroll administrator, anytime you're going to do something like that, just stand back, question it, pick up the phone, give them a call and say, hey, are you asking for this? Because there have been more than one occasion where that file gets out and those individuals then use that information to file fraudulent tax returns on behalf of the employees, and it gets really messy really quick. Maybe you would, maybe you wouldn't be surprised to hear the number of times that that particular phishing scheme has happened. So with that, I'll say thank you from Integrity Data for letting me present, and I hope you got a lot out of today's webinar. Valerie?
Yes, thank you again for attending. I will be sending a link of the recording from our YouTube channel, as well as a copy of Tom's slide deck with all the links that he has provided you. And then again, if you have any need for an ACA reporting software and you're a Dynamics SL customer, please feel free to reach out to me or your Microsoft partner and get some information on the Integrity Data SL Edition that we can provide you, which is a cloud-based product that also pulls directly from Dynamics SL payroll information. Thank you again for your time and for attending, and have a wonderful day, everybody.